Good morning to all the judges for this project. I'm by names of Natami Faith Gloria, a team member of ePlatform Medical Equipment Accessibility Project. The ePlatform Medical Equipment Accessibility Project is to be a long-term project to be implemented by Save a Life organization. This project is to target the local communities in Uganda for those who have been mainly affected during the pandemic with less accessibility to medical drugs, especially those with chronic illnesses. The main beneficiaries for this project are people who have been diagnosed with chronic illnesses, for example, HIV, diabetes, asthma, and need continuous treatment, for which, if treatment is delayed, could lead into death, disability, and opportunistic infections, that is for persons with HIV. Our main aim is to work with village health teams that the community will reach out in case there is great need for the medical equipment and drugs, and we'll reach out to our team and we will be able to do the delivery. The problem statement, as indicated, is a large body of evidence confirms that many people in the developing world go without health care from which they could benefit greatly. Following the declaration of COVID-19 as a global pandemic, countries globally in the sub-Saharan Africa, including Uganda, instituted lockdown measures in various degrees. Such measures included movement restrictions and curfew unless following the protracted approval process from political leaders in one's locality. These measures resulted in disruption of healthcare services access for both acute and pre-existing health conditions. Reports of patients with chronic illnesses missing hospital appointments in fear of contracting the disease were reported from different parts of Uganda, despite the fact that telehealth services are provided by Infectious Disease Institute, Baylor Uganda, and MTCG. And some of the services they provide is remote teleconsultation via voice, chat and video platforms, SMS reminders on facility appointments, and mobile SMS health information dissemination and awareness for behavior change. There is still a problem of language barrier in that people down there in villages, some of them don't know English. And it will be of help that if we introduce this application, the VHTs will be able to translate to persons in those villages about the application, and in case they need any medication or consultation, we shall be able to provide them with the services at no charge, but only they will be able to pay for the drugs themselves only. However, there are still existing gaps in the telehealth service, including radius of coverage, service coverage. There were geographical limitations accessing on-demand medical deliveries and mobile lab sample pickups for non-COVID-19 related medical services, as major providers were limited to some parts in Kampala. This greatly affected the completion of referrals and linkages to services uptakes after the teleconsultation and documentation. With some proven evidence, me myself, where I'm volunteering at Love to Love organization, which mainly focuses on ensuring adherence with continuously advocating for U equals U program. We as a team, we as volunteers were able to reach out to only those who were able to access our contacts, be able to deliver them with medications in case their antiretroviral drugs are out of stock, and those that were unable to access us were not helped out. And I think it's of view that this application will work to help every person in the country, regardless of the location, regardless of who they know. But in case they know the VHTs, they will be able to access the medications at home with free delivery. It's of this that we came out with an idea of developing an online e-platform medical equipment accessibility app that will be accessed by all persons within Uganda plus the local communities at large, Africa as a whole. For persons living in villages, we shall be able to conduct trainings with the village health teams, provide them with electronic devices, for example, the tabs that they will use to alert the medical teams, including us, on persons that need treatment or medical consultation. This will also bridge the gap in language barrier. Our mission is to prevent disease, promote health, and prolong deaths of persons with particular diseases in local communities, especially those with chronic illnesses. To respond to the underlying demand for medical drugs and equipment, those in great need without discrimination at no charge is our goal. Objectives is to improve health for all persons regardless of their financial status and their location, to reduce mortality and morbidity due to chronic illnesses and many other kinds of illnesses, to increase access to medical drugs and equipment as required with reduced costs for patients since there will be free delivery. Some of my team members are Mr. Semju Francis, the monitoring and evaluation specialist, Mr. Bisaso Sam, who will be our mentor. Other relevant persons such as the web developer, data scientist, pharmacist, and nurse will be recruited, critically accessed to be part of that project in case we get funds. The outcome of the project, there will be improved health for all persons regardless of the financial status and location. There will be reduced mortality and morbidity due to chronic illnesses and many other illnesses. There will be quick access to medical drugs and equipment as required with reduced transport costs for patients since there will be free delivery. All this is what I had for the presentation of e-platform medical equipment accessibility project. I look forward to hear from you, my judges. Thank you very much. I remain Natami Faith Gloria, a public health specialist.